So doctor, we left off last time with testing for HIV. So what does one do if you do test positive for HIV? What is the long-term plan?
Right. The first step once a person is diagnosed HIV positive is counseling. And we refer to this as supportive counseling. Okay. Because when a person knows that he is HIV positive, he may be in shock, he may be suicidal, he has no idea what HIV infection is. So we have to support him through that whole process and tell him what it means to be HIV positive, the implications of being HIV positive, that it's a lifelong disease and they need to be under the care of a doctor and a counselor for the rest of their lives, without really, making them feel afraid about that. And then we counsel them about diet. They need to be on a high protein diet because that helps to keep the immune system strong. They need to have the regular bouts of exercise. They need to be relaxed, have adequate sleep. So we talk to them about all of this during counseling.
Okay. So what are the different kinds of counseling that are available?
For HIV AIDS, there are different types of counseling. You have the pre-test counseling before you do the test. You have the post-test counseling for negative. You have the post-test counseling for positive. You have the supportive counseling. You have family counseling where we counsel the partner or the other members of the family if the patient wants to tell them. And then we have the counseling for starting on treatment. We have the counseling for adherence where they have to maintain a high level of adherence before starting their ART. Then we talk about follow-up counseling, counseling for prevention of mother-to-child transmission of HIV, and then we finally have bereavement counseling if for the family if a person dies from the infection.
Okay. Now it's easy to see how a positive diagnosis will affect loved ones as well. So how does a partner or a spouse get involved in counseling, and how are their sex lives affected?
So the first thing is that the person who's diagnosed HIV positive, he or she herself would take time to, accept that they are positive, and then they will be ready. We encourage them to tell the spouse. Many of them find this a very difficult thing to do because it has a lot of implications. And so they take their time, and during this period of time, it could be just from a few weeks to even few months before they want to inform their spouse. So the one thing that we do emphasize is they must use a condom till they are ready to tell their wives or husbands. And then they bring in their husband or wife, and then we counsel them together. But we encourage this the infected person to tell his partner. Yeah. If he is scared to tell his partner on his own, then he will bring the partner in and we will talk to them.
Okay.
So and then many times it's just the husband and wife who know that they are positive in a family. The rest of the family may not even know. But if they do want to know, then based on who he wants to tell, he wants to tell that he has this disease, whether it's his father, his mother, brother, sister, friends, he brings them in and then we talk to them about it.
Okay.
But it's entirely up to the discretion of the person who's HIV positive.
Right. Great. Thanks so much, doctor. In the next episode, we're going to talk about medication since counseling is only part of the treatment. Don't forget to subscribe and we'll see you guys later.